Hello, my name is Rebecca Flowers. I've been an occupational therapist with specialty in pediatrics and in a neurological frame of reference called sensory integration for almost 35 years. I say that by way of telling you that I've had a lot of experience with working with babies and children. And within 4 years of graduation as an OT, I discovered another tool to add to my toolbox of knowledge that has helped me tremendously over the years. It's called CranioSacral Therapy. It's out of the osteopathic community, and it was brought to us, it was popularized in the 1970s, the early 1970s, by Dr. Upledger. It is the craniosacral system that we're going to be talking about is the one system in the body that houses the entire central nervous system. So we're talking brain, we're talking spinal cord. And that being said, there's very little in terms of problems that we have physically as well as socially, emotionally, because all of those things are brain function too. So there's very little that cannot be helped by craniosacral therapy. The premise of craniosacral therapy is that if we mobilize the bones, which, by the way, Dr. Upledger with his team of researchers at Michigan State in the 70s proved there is movement that continues through the lifespan of all of the different bones at the sutures. That's what these wiggly, squiggly lines are called. That movement and that system, that membrane system, is continuous all the way down to the tailbone. And it's continuous from the meninges lining the skull through the hole in the base of the skull all the way down. There are some of you watching this video who are at home right now with a baby that has colic. And if you are, I want to tell you that there is hope for this kind of a problem. Colic has been diagnosed as, the frequency of babies upset. There's still a lot that allopathic medicine does not know about it. What causes it? Why does it go away when it does? Why does baby seem to outgrow it at 12 weeks or so? Why do some babies outgrow it and some don't? What in the world is going on? Well, from a craniosacral perspective, if we look at what's happening within that central nervous system, we have to think about the autonomic or automatic way in which the brain functions. So, when we think about autonomic nervous system or automatic nervous system, we're talking about brain stem. We're talking about functions that occur below the level of thinking, below the level of cognition, we would say. So things like resting, digesting, breathing. We don't have to think about all of those things. Those things are automatic. And much of that is balanced by a nerve that also begins in the brain. So it is called one of our brain stem or cranial nerves. It's cranial nerve 10. It's the vagus nerve. She's the queen of resting and digesting. Well, for those of you that have a baby with colic, or you've had a baby with colic, maybe you're pregnant expecting another one, or maybe you've already gone through this before, but you wish you knew what and why, or maybe you've got a friend or a neighbor that you could help. Maybe you've got a grandchild that you'd like to help. Craniosacral can be very helpful because we are working Once again, if we refer back to the craniosacral system over here, we're referring to the one system within the body that houses the brain and the spinal cord. So that includes all of those cranial nerves that are controlled by the autonomic or automatic brain system. Okay? Now, that system has two ways of functioning. We've talked about the vagus nerve, cranial nerve 10, being the queen of resting and digesting. The other side of that, the other way of functioning, that way of functioning is called, by the way, parasympathetic function. The other way of functioning is what we as adults think of in terms of thinking, going. I got my to-do list. I've got to check this off. I've got to get this done. I got to get kids here. I got to, etc. We stay on sympathetic nervous system. We think of it in terms of fight, flight, or freeze. But it is that system that gears us up and activates us for readiness. It gives us our alertness. And if we are in that stage alone, it's very, very difficult to switch over to resting and digesting. What we need is like a scale that is evenly balanced. Not too much sympathetic, and yet not too much parasympathetic either. Not too much of the sleeping all the time. Now granted, a new baby is going to sleep a lot. That's normal. That's normal within the first 3 weeks. But when it gets to the place of being very, very out of balance in the direction of too much sympathetic nervous system function, it makes it very hard for that baby to go to sleep, to stay asleep, to sleep soundly and without fidgeting, without being really restless, to be restful in their sleep, and to be able to digest their food. What is seen with colic is oftentimes baby drawing its legs up and squirming, as well as keeping their eyes closed like they're shutting out the whole world, and screaming. They are extremely uncomfortable, and they don't know what to do about it. A lot of times you'll see a lot of gas that accompanies that, and a lot of spit up as well. They can't rest, they can't digest. It oftentimes has to do with that imbalance of the autonomic nervous system. And given the fact that in CranioSacral Therapy we address the one system that houses the entire brain and the spinal cord, we can impact a very positive change. So, to begin with, we want to relax. We want vagus nerve more in play, right? So let's talk a little bit more about the vagus nerve. Vagus nerve is, in Latin, vagus means the happy wanderer. So it's called the largest of the cranial nerves because, not because the nuclei is larger, but because it exits along the spine more times. It goes to what we call innervate more things. So it first exits up there between C2 and C3. C stands for cervical, so the second and third cervical vertebra. Well, what if you see baby doing this a lot? Or what if you've watched another segment of our talks, what if it's a baby that's got a torticollis? What's that doing to that nerve? And it also exits to the heart, so it's responsible for our heart rate. It also exits to the diaphragm, so it's responsible for our respiratory rate. What do you see with a baby in colic? You see their little heart pity-patting very fast. You see their respiration very shallow. It also goes to innervate the entire digestive tract. So the vagus nerve is responsible for our stomach emptying, for example, and our peristalsis. It's very, very important in terms of our digestion. And if it's not calm, if it's over reactive in any of those end organs, what's going to happen is that we're too much heavily weighted in terms of sympathetics. So now we don't have a chance at resting and digesting. How do we address that in craniosacral? Very simple. What we learn in craniosacral therapy is to feel where the areas of restriction are in the body that are problematic, and oftentimes it's where we have an issue with vagus nerve being compromised. So we simply address it through our craniosacral techniques. More often than not, baby falls asleep. And by the way, that happens with adults too. So if you're watching this and you're someone who has experienced a craniosacral session and you have felt like, I just can't keep my eyes open, and your practitioner says, go ahead and fall asleep, it's just fine. That's where your body does most of its self-correction. Then you know what I'm talking about. It balances that autonomics, and for many of us as adults, we spend a lot of time up here going, doing too, so that when someone comes along to help us get more on a balanced level, we are so deeply fatigued that we fall asleep right away. Same happens with the baby. So, craniosacral, very effective for colic. Now, what causes it in the first place? Well, we've mentioned the torticollis in another talk that we've done in this series. We've talked about things like scoliosis. We've talked about the twist that can be induced in the whole spine. So, yes, it can be caused by a number of factors there, but why a newborn baby? Why does it start out like that? Well, think about the pregnancy. Think about mom's state during the pregnancy. Was she tremendously stressed? Was there a death in the family? Was there a lot of upset going on? Because all of mom's hormones, by the way, are being fed through the umbilical cord into the placenta, so that baby is aware if there are stress hormones in mom, baby's going to get those too. Okay, so that can sometimes set us up. But one of the main factors is, what was the labor and delivery like? Was it a traumatic experience? And when I say that, I'm talking about the kinds of things that as mothers we don't ever plan for. We couldn't possibly imagine, so we don't want to. We think about it's going to be defined. Women have been having babies for thousands of years, and everything is fine. Well, we know that it's not always fine. So, what can happen? Well, one of the things is, in the traumatic birth, is a situation where baby gets stuck. And sometimes that is a non-issue because we see it in ultrasound ahead of time, and so the doctor, the obstetrician, is prepared for doing a cesarean birth. Oftentimes that's not traumatic, but what if baby goes into distress, and baby's already engaged in the birth canal. What happens is that umbilical cord gets compressed, and then baby gets compromised with how much oxygen through the blood supply that they're getting to their brain. So they have to come out quickly. Worst case scenario, cesarean birth, where baby's engaged and they have to go in and do a vacuum extraction from the inside, pulling him back out of the birth canal. Any kind of severe force trying to get that head out, whether it's vaginally, high forceps aren't used anymore. My oldest son, who's 48 and a half, he was a high forceps vaginal extraction. Okay? Nowadays, they wouldn't do that. They would have gone ahead and done a cesarean. I'm glad they didn't, because he was so engaged in the birth canal already, they would have been doing forceps, pulling him back out the other direction. Would have done a lot of damage to his neck, and we know what that would do over here when we talk about between the second and third cervical vertebra, the vagus nerve exiting. Okay? So, if you have a vacuum extraction, for a while that was very popular. For a while the high forceps were very popular. Now they're almost never doing a high forceps because it can do some damage to the facial nerve and you can end up with partial paralysis. They might use slight forceps to position the head, but now they're using more the vacuum extraction for those really difficult, complicated births. And that's one of the things that sets us up right away with the possibility of the scenario of the colic. Now, while we're talking about the vacuum extraction, I want to talk a little bit about what that looks like for the brain. When we look at these pictures on the poster, we're looking at an adult skull. We're looking at bones where the sutures have formed, and bones that when we start out as a newborn, those bones are still in pieces. For example, the base of the skull back here, when we're born, isn't one piece. It's multiple pieces. Okay? So, we have that's in pieces. This bone that looks like a butterfly is in pieces. This bone where the hole is for your ear canal, that's your temporal bone. That bone's in pieces. Even the forehead, the frontal bone, is two separate pieces. And some of those fuse by the time we're 12 months old. Some of them, like the base of the skull, the occiput, don't fuse until somewhere between 7 and 9 years. With some people, the frontal bone, your forehead, never fuses. It's not that there's a problem, it's just that in a certain percentage of people, it's never fused. But what we have when we're born, instead of having these what we call interdigitations at where the bones come together for the sutures, instead we have fontanelles. So Dr. Upledger used to describe it as bones floating in membrane. And there's more than one. Most people just think about soft spot here. But we have back here another, that's the bregma, and we have over here where the butterfly bone is, we have one on each side. We have another back here where this becomes this extension here, the mastoid. We have another here. Why? Because that little skull is supposed to be able to overlap those bones to be able to get a large object out of a small space, right? But when we're having to do vacuum extraction. We're taking this membrane system, this very, very delicate membrane system. And these bones, by the way, are very thin compared to this model, to yours and mine as adults. So when there is a vacuum extraction, it is literally not only pulling the head and, of course, the neck as it goes with it, but it's actually pulling brain matter up. And what happens if, and it takes a lot of force, I have known situations where the obstetrician had to pull with force such that a foot was up on the operating table and all of that doctor's weight had to go with. So sometimes there can be as much as 80 pounds of pressure. All right? When that happens, it pulls the brain tissue up. What happens if it slips off? Okay? So, if that suction is allowed to come off, or if it accidentally comes off too fast, what happens is what we call, with the traumatic brain injury, if you've done any reading about some of the vets over in Iran and Iraq with all the concussive explosions, they talk about a contra coup. Okay? Brain gets sucked up, plops back down to the other side. That's called a contra coup. That results in a brain injury. Well, what does that mean? It means that it can do some damage on the inside to the delicate little nerves, the tiny little blood vessels, and so on and so forth. So that's another causative factor to get us started into the whole scenario of colic. Now, obviously that is not the only cause of colic. We need to talk about the gut health and the gut biome of mom, and what the scenario is for the baby as they come through the birth canal, because baby's going to inherit whatever mom's flora is. We know that since post-World War II, we've had processed food. And thank heaven we did, or all of the UK would have starved to death. Okay? But because it was convenient, it persisted. And then we went from processed food to fast foods. I can remember in my lifetime the first drive-in restaurant that we had in our town. And then we went from fast food to junk food. So most of the moms in the last 2 or 3 generations have gut flora that have been passed on to their babies, which is not optimal. So that baby is suffering already with an imbalance of the gut flora that they got from mom, and that's a huge causative factor as well. That needs to be addressed by somebody that can help with functional medicine. So that's colic. That's how we work on it. It can be extremely helpful to add craniosacral therapy into the taking a look at what can help with that baby.